Stigma is one of those things where you're unconsciously saying things that may not be true. Internalized stigma is taking all of those things that people say negatively, and then you internalize that, and so you start to believe it about yourself.
Internalized stigma impacts people living with HIV because society has been telling us that they are to blame for their own condition and that they are to blame for the spread of HIV. That is a very dangerous idea, because people living with HIV start to believe it about themselves.
We find that there's a lot of stigma in society today. People are stigmatized, not just the people from the outside who have negative feelings about HIV positive people, but also family members, the community at large, the churches, the schools. It becomes a problem for the person who's seeking help, because that person in turn feels as though, yeah, look, people are gonna think, yeah, I went out and I did something I shouldn't have done, or I was in a relationship that I shouldn't have been in, doing something that I shouldn't have done. I think stigma is something that kills, because whenever people are so traumatized or feel so marginalized that they can't go out and get help, then they stay in the closet. They bear their sicknesses themselves.
So if people perceive that they do not belong, they are not part of, or that the services are not for them, then we have a challenge of access. A way of addressing stigma in public health is by creating counter-narratives. And we can use counter-narrative in our interaction with patients and in our healthcare environments. By creating counter-narrative, we are embracing the diversity that our patients represent.
A counter-narrative is an affirming message that undermines the logic behind a stigmatizing stereotype. U equals U is a counter-narrative because it rejects the idea that people living with HIV can transmit the virus, or that they are vectors of infection.
It's combating HIV stigma because a lot of people feel like even if you're on medication, then you're still out there spreading the disease, and that's totally not true, especially with the science behind it. It's that if you are undetectable and you've been undetectable for at least 6 months, then there's a 0% chance of you actually affecting someone.
If we treat HIV as a manageable disease, we can more or less take HIV and say it's like diabetes, it's like high blood pressure. All these things can be controlled. If we can get that message out, then this becomes a secondary thing. It's like, yeah, I've got HIV, but I'm living with it, and it's manageable because I'm taking medications, just as you take high blood pressure pills, just as you take insulin for diabetes.
People are coming out more, even with their status now, because they feel like they're not a threat to society anymore, and it's a therapy for them. To actually come out and say, hey, I am undetectable, I am untransmittable, and I am not a threat to society, and I am living my life. Health departments want to do the work, they just don't know how to get started. And so it's very important to talk across jurisdictions to really say, hey, these things are available, and you may be able to actually use the tools that we're actually using and then bounce ideas back off on each other.
Addressing stigma, internalized stigma specifically, is going to be crucial for health departments that want to meet their goals in ending the epidemic.
The healthcare departments don't have to reinvent the wheel. We already have a set of tools that are evidence-based, proven to be effective in reducing stigma experiences for our patients. Combining those strategies and making it culturally relevant to your audience might be the best way of addressing stigma that is cost-effective and is also relevant to the population that you provide services to.